Today, we are going to talk about how your balance may be affected after a stroke. One important topic to discuss before we delve into the potential balance problems after a stroke is how your balance is controlled when you are well. There are three major systems responsible for helping you balance. The first is your sensory system, which sends information to your brain about where your body is in space, whether you are turning or accelerating, and whether you are standing on a firm or soft ground, for instance. The second system is your vestibular system, which is responsible for orientation to upright and sense of movement of your head in relation to your body and your surroundings. And the most important system is your vision. Any of these symptoms could be affected by stroke, depending on where the damage occurs within your brain. You may experience weakness in some of your muscles after a stroke, or you may lose control of them altogether. This can lead to problems related to balance and movement, especially if your stroke has affected the left side of your body. These complications can affect your balance, making you feel dizzy or unsteady, which can make moving around and reaching for objects more difficult. A stroke can affect the way your muscles work as your brain sends signals to your muscles through your nerves to make them move. Most movement problems are caused by an inability of your muscles to contract normally. It's common for a whole side of your body to be weak after a stroke, but you may have weakness in just one arm or one leg. You may find it difficult to balance in sitting or in standing. The most common issues that can affect your movement include drop foot. This is when your toes catch the ground when you step forward because the muscles that lift your toes are not firing. Loss of sensation. You may find it difficult to feel where your leg and foot are, making you become somewhat clumsy and experience difficulty controlling your movements. Lack of concentration. You may notice that it takes a lot of concentration to focus on your balance and may overlook things such as uneven surfaces, changing direction, or even walking and talking at the same time. Less common issues that can affect your balance include perceptual problems. You may find it difficult to maintain your balance due to not being able to accurately interpret your surroundings. This is often associated with right brain strokes. With perceptual problems comes neglect. Neglect refers to being unaware of one side of your body or body part, making it difficult to move safely. Vision. Vision problems are quite common and can include difficulty focusing, double vision, blind spots, and eye coordination problems. Medication side effects. Medications commonly prescribed after a stroke can cause dizziness and/or weakness. Examples include those for high blood pressure, diabetes, depression, as well as blood thinners. Generally, trying to get moving as soon as possible can help with your recovery. Improvement tends to be fastest within a few days or weeks following a stroke, but can continue for months to years depending on the individual and whether or not therapy is continued long term. Balance retraining exercises are effective ways to help treat balance problems. For these exercises to be effective, they must be intensive. Do as much as you can, as often as you can. These exercises must be individual, tailored to your needs, goals, and the severity of your impairments. These exercises must be functional. You need to practice activities that are challenging and relevant to you, such as sitting and standing up or navigating obstacles while walking. And finally, these exercises must be progressive. You need to keep challenging yourself to continue improving. Once something becomes easy, it needs to be made harder again. Exercises may include things such as step-ups, moving from a sitting to a standing position, practicing reaching for objects, or standing on unstable surfaces with the assistance of a therapist. Other exercises can include treadmill training, which can be done very early on with the right equipment to help support you if you cannot help stabilize yourself. Gaze stabilization exercises, which can help people with dizziness, double vision, or vertigo. Computer game consoles like the Wii, which can help improve strength, movement, and balance with game interaction. Tai Chi, which can help balance with slow and graceful movements. Items such as trekking poles, canes, and walkers can help improve stability and confidence when you are walking. If you have drop foot, you may need an ankle foot orthosis. This splint helps lift your toes and support your ankle when you stand to prevent catching your toes when you take a step forward. Your physical and occupational therapist will help promote the right type of therapy or recommend the right type of equipment for you to make sure you are progressing with your balance at this stage of your recovery and beyond.